Buenas noches y bienvenidos al segundo programa de Pulse on Choice TV. Aquí tengo conmigo dos médicos que vamos a hablar de un tema muy especial. Estoy hablando en español porque este programa trata de la Semana de Apreciación con Cuba. So I'm going to say this in English, Saint Lucia. Good night and welcome to our second program of Pulse on Choice TV. Tonight I have with me two doctors, one dentist, one nephrologist. This is a special program because this is the week of appreciation for Cuba, and we're going to, at the end of the program, show appreciation for what was given to us, in all those years of study in Cuba. At present, though, we're going to start the program by dealing with a topic which I think is very appropriate to address. It's one of those topics which, the term alone is not the most pleasant. It's a term that I don't even like to say, and I'm probably going to say once or twice in this whole program and find another medical term by which to refer to it. But it's one of those topics that I think everybody really wants to know about, everybody wants to understand. So let me introduce my guests, and then I'm going to tell you what topic we're going to be dealing with today. So I have the pleasure of introducing Dr. Merle Clarke. Dr. Clarke is a nephrologist who studied in Cuba. Dr. Clarke has been making waves with nephrology. Kidney disease is now on the Saint Lucian map, right? Because Dr. Clarke has been making sure that she gets out there. So she's here with us tonight. I also have Dr. Atef Daniel. Dr. Atef Daniel is a dentist. He works in private practice, but he also works with the public healthcare system at the Grocery Polyclinic. And Dr. Daniel is also a Cuban-trained dentist. So tonight, viewers, we're actually going to be talking about halitosis. Now, halitosis is the medical term. Halitosis means malodorous breath. A malodorous breath, I'm going to say it once or twice, is what we colloquially would know as bad breath. So we're going to be looking at bad breath, how it is caused. I know there may be many of you out there who would have at some point been insecure about your breath, wondering whether or not you have bad breath. What would you do? What would have caused it, how do you treat it? So we're going to be looking at those causes, and then we get into our Cuba Appreciation Week, and and we're excited about telling the Cubans just how much we love them. So let's start off, Dr. Atef Daniel, with talking about bad breath. So before I go to Dr. Daniel, we know that bad breath has two main sources. We say that bad breath can originate from the oral cavity, but we also say bad breath can originate outside the oral cavity. So Dr. Daniel, being a dentist, will tell us about bad breath which originates from within the oral cavity. So Dr. Daniel, where does this halitosis, malodorous breath, come from, or what originates in the oral cavity? What's the problem there?
Just before we jump into that, let me just say that even as a dentist, it's not very easy to talk about bad breath. Like we say sometimes, the patients who come to me, sometimes they will have to pull me on the side out of the assistant, because it's something that persons are not very comfortable speaking about. But today we're going to address it, and hopefully we're going to, if you suffer from that problem, really get some solution to it, and it will make you a lot more confident in your relationships.
Make everybody more comfortable, right?
That's right. So we're talking about intraoral causes of bad breath, or what happens in the mouth to cause it. And right off the bat, we'll say that most of it stems from or starts from poor oral hygiene practices. Fancy way of saying that we don't take care of our mouths properly. We don't clean our mouths as we should.
Right.
And these oral hygiene processes, we know them very well. Brushing our teeth, flossing between our teeth, and that has to be complemented by, getting those regular cleanings, professional cleanings done by the dentist.
Right.
When these are not done properly or as it should be done, it gives rise to a number of what we call oral diseases or pathologies. And the two main ones are what we know as cavities, dental cavities. The disease is actually called dental caries, really, because sometimes you can have the disease and not see a hole, and it gets very confusing for the patient.
As such.
Patient comes and tells me, but I don't see a cavity, I don't see anything at all.
Right.
Yeah, but it's not the hole that's a cavity, it's the disease, really. And what is it? It's actually tooth decay. Right. And we know that when we talk about decay, anything that decays, it gives off an odor. I mean, there are examples that we can cite, some of them not very pleasant, really, but once there is decay, it gives off an odor. Also, the other one is periodontal disease or gum disease. Caries would affect your tooth, whereas gum disease would affect the support for your tooth, the supporting structures, the gums and the jawbone. And that also, gives rise to these odors. And let us say quickly that these are actually caused by bacteria in the mouth in what we call, dental plaque. Dental plaque is just a term that has been used to describe the whole buildup of bacteria that allows these processes to take place in the mouth. Right.
So we're saying, Dr. Daniel, that it's really that when we do not, make sure that those dental practices are followed as they should, and that we make sure they're done regularly, that there's a buildup of microorganisms, there's a buildup of bacteria that will ultimately cause the bad breath. So I know you've already mentioned that tooth decays can cause bad breath, and we say even before there's an actual cavity or hole, caries can cause bad breath. We mentioned gingival disease of the gums, and gingivitis is a common one. But we also know that even without those being present, and we say you might go to your dentist and your dentist tell you have no cavities, you have no gingivitis, but there's something else that's missing, and that might have to do with the tongue. You want to tell us a little bit more about how the tongue gets involved in this whole thing?
We'll get into this, really. It is said that 90% of bad breath comes from the oral cavity or is intraorally based, comes from the tongue.
Right.
So a lot of times, we say brush your teeth, floss between the teeth, and you don't say anything about the tongue, really.
Brush your tongue.
And it is the chief culprit in causing bad breath. Why? In the mouth, we have bacteria. We know that the mouth is full of bacteria. And the bacteria in the mouth, they use the foods that we ingest, to carry out the processes.
Right.
And at the end of these processes, you have compounds that are formed in the mouth, or toxins that are released by this bacteria. And one of them are what we call, or what is known as volatile sulfur compounds. Now, when you have sulfur in Saint Lucia, first thing you think of is a sulfur spring. Huh?
Yeah.
And we all know when we drive to Soufrière, what happens?
Right.
And that is actually
now called the sulfur bombs or something that they use. That the people cause foul odors.
So you think about it, that look, that is what is actually happening in the mouth. That the bacteria in the mouth, they release these sulfur compounds, and of course they don't smell nice at all.
No.
And the back of the tongue, it accumulates in the back of the tongue, and if the tongue is not cleaned properly, attention is not paid to the tongue, then you can have that foul or unpleasant odor emanating from the tongue, really.
Right. I know one friend, Miss Felicia Montoot, who's a dental hygienist, who likes to say that your tongue is the rug in your it's like a rug in your house, because it picks up dirt and food remains and odors and everything. So we have to make sure we clean the rug in our house, which is our tongue in reference to our mouth. We talk about the tongue, and you'd ask yourself, what part of the tongue really? Because most people will say yes, they actually do clean their tongue, and I think most people don't go too far to the back because of the gag reflex. It makes them feel like throwing up. So what part of the tongue is important in cleaning in terms of removing any odors from the mouth?
Right, the back of the tongue is very important because, like you just said, that is where most of the bacteria builds up. That is where most of the compounds actually build up on the tongue.
Right.
It's not very easy to clean initially, if you've never done it, really, to get all the way in the back there, because there's a reflex that you feel like throwing up if you get anything to it, because that is a protective reflex,
right,
in the body, really. But it can be neutralized. What we advise patients is to stick out the tongue, and you go from all the way to the back, and get, now you have a number of things on the market that have been used, invented to help clean the tongue, and some of them are tongue scrapers, some of them are tongue brushes, but a simple toothbrush would do.
Oh, yeah.
The important thing is to actually brush the tongue and to keep it nice and clean, really. So we advise that patients that they stick out the tongue, and they say ah. So when you say ah, it can neutralize that gag reflex.
Okay.
Yeah, and you get whatever it is that you're going to use to scrape the tongue all the way to the back, and you use a forward motion in cleaning the tongue.
Right.
You can use simple toothpaste, like a regular toothpaste, to help get that done. We advise that you use some baking soda as well.
Right.
You know, just to help get that cleaning effect.
Right.
I've advised my patients, you know, if they really have a problem, get a clean rag, hold on to the tongue, because sometimes it rolls back, you know, you can keep it there, and the brush
Scrub
and
it out.
tongue, you know, until it's nice and clean, and you feel that it's nice and clean, really.
Right. I remember when in primary school, if someone would say something which was foul, they'd say, scrub out your tongue. You know that?
You have a dirty tongue.
Yeah, that's a truly dirty tongue which needs to be cleaned out. So I think there's also the reference to certain instruments which could be used to help to clean out the tongue.
Right.
Instead of actually using the toothbrush, because I can say for myself, whenever I use a toothbrush, I get that gag reflex. It's very difficult to avoid. Is there anything else that can be used?
Oh yeah, I mean, there are a number of tongue scrapers on the market, and surprisingly today I started looking at a few of them. I never knew that there were so many of them, really.
Right.
But all to the same end. It's a simple mechanical scraping, and it's actually the mechanical action of doing it and scraping it.
Right.
Which is the same thing with toothbrushing. A lot of times you say, okay, I brush my teeth 10 times for the day. But what is happening? But it's the actual mechanical process of doing it properly and removing what's on there, because it's actually the removal of the stuff on there that is going to get it nice and clean.
Film,
really.
as
That's
is
right.
sometimes referred to, a
biofilm that forms on the tongue.
On the tongue. And that the whole tongue should look nice and pink, right?
Yeah, we won't always get it to look that way, really. But the important thing is that film is removed.
Right.
And that, because persons have different tongues, really. I mean, you know, human beings vary. I mean, and some of them, you know, you have little furrows in the tongue. Some of them, the tongue's a little hairier than normal.
Right.
Some of them, even the tongue's a little darker than normal, really. But the important thing is to clean it out properly so that you know that it's nice and clean. It feels nice and clean.
Right. So, before we end talking about the intraoral causes of bad breath or halitosis, and we're saying intraoral meaning causes which are sources of halitosis or malodorous breath coming from the inside of the mouth, right? So we looked at gum disease, decaying teeth, or dental caries. We looked at the tongue not being cleaned out properly. Is there anything else that should be kept in mind in terms of what might be an origin of a bad odor from the mouth?
Oh yeah, I mean we can talk about habits like cigarette smoking.
Cigarette smoking, yeah.
Yeah, I mean that a lot of times the breath is very alcohol as well. It's very offensive, really.
Right.
Yeah. Also we've just mentioned gum disease and tooth decay, really, which are the most common ones. But don't forget that, you know, I mean, we can have cancers developing in the mouth. Ulcerative processes in the mouth, infectious processes in the mouth as well.
The tonsils, so maybe
all of these give rise to these odors emanating from the mouth.
Right, and unfortunately, some foods may be causes of that bad odor as well. Eh?
Yeah, the diet is very important. We talk about garlic. Garlic is one of the chief culprits as far as the diet.
Yes.
There's this characteristic smell or odor that
garlic causes, yeah.
But the thing is that it's transient, really, and but we have more of a problem when it's just doesn't seem to be going away.
Right.
Yeah.
Right. So I know garlic, onions, even fish and meat are sometimes considered culprits of change in the breath.
In the breath, yeah.
Yeah. Okay. So I think when we come back, we'll get into with Dr. Clarke the extraoral causes of bad breath, because we're saying that bad breath does not only originate from inside the mouth, and we need to be aware of other places that may be causing a change in the breath. There's one more question before we take the break that I think I'd like to put to you. The change in the odor when it's a source from within the mouth, or the odor when it's a source from within the mouth, is of a characteristic? Is it different characteristic from outside the mouth, or is it the same?
Oh yes, it is. It has been described as a fecal odor. Now, that's not a very nice description.
Right.
But really, that is
true.
what it is.
Right.
It might be very true when you compare it to other odors, really. And I guess Dr. Clarke is going to get into the other odors. And we know when we talk about feces, we all know what we are referring to, that sort of odor.
Right. And we're saying again that odor is because of those sulfur compounds which are liberated when the bacteria feed themselves on what we eat, on the proteins that we eat. So those sulfide compounds cause that fecal odor. Okay, viewers, you've been watching a second episode of Pulse Live on Choice TV. I've had the pleasure already of having Dr. Atef Daniel describe the causes of malodorous breath. I was about to say the other term that I don't like, which originate from within the mouth. You stay tuned with us as we return to talk about malodorous breath and the causes originating from outside of the mouth. We'll be right back. Stay tuned. Welcome back. Okay, we've been talking about halitosis, which we said is malodorous breath, colloquially called bad breath. And we started by talking about causes of halitosis originating from within the mouth. Now, Dr. Atef Daniel is going to give us a quick summary for those of you who missed our first segment of where this change in the scent within the mouth comes from and what we should do. So I'll let Dr. Daniel tell us a bit. We have some images that we're going to put onto the screen so that our viewers can see her.
Okay, so we've said that these malodors result basically from not taking care of our mouths properly, not doing what is required to keep the mouth nice and clean. And that results in what we call plaque actually forming around the teeth, around the gum area. And that gives rise to oral diseases like cavities, which we see here. And of course, it's actually tooth decay, and it releases an odor, a foul odor. Also gum disease, or what we call periodontal disease, where the bacteria actually builds up in those pockets around the teeth, and that as well releases a lot of pus, and you have that odor as well. And very importantly, we said that the tongue is often ignored, but 90% of the malodorous breath that comes from the mouth comes from not paying close attention to keeping the tongue nice and clean, because volatile sulfur compounds form on the tongue, and the odor is not very pleasant, and we have a number of ways that we can actually keep the tongue clean. So how do we prevent cavities or caries and gum disease or periodontal disease? By brushing our teeth, by flossing at least once for the day, brushing our teeth after meals before going to bed, and by keeping the tongue clean, whether it's with fancy gadgets like a tongue scraper, a toothbrush, or a simple spoon would do if you don't have any of those fancy gadgets, but you have to keep it nice and clean. So we spoke about the gag reflex, and we said that, look, you can't just push an instrument into the back of the tongue. It would cause you to gag. So what you do is to stick out the tongue, you say "I," that helps to neutralize the reflex, and you scrape from the back to the front until it is nice and clean. And you can use some baking soda to help as well, and regular toothpaste.
Okay, so very nicely done, Dr. Atef Daniel. Thank you very much. So I'm going to go to Dr. Clarke now to tell us. Dr. Clarke is a nephrologist with lots of experience in internal medicine, and so she's very well equipped to tell us about causes of bad breath or halitosis that originate from outside of the mouth. Okay. So Dr. Clarke.
To start with, we can look at the areas which are close to the mouth.
Right.
Some of the common causes of halitosis infections of the upper respiratory system. And when I say upper respiratory, I'm talking about the larynx and the pharyngitis. Or, for example, when you have a common cold, we all know when we have a common cold, nobody really wants to go out. Quite apart from the stuffiness, the breath really isn't the best. Exactly. Right, so nobody wants to go to Girls' Day Friday night when you have a common cold. Right. We're also looking at conditions like rhinitis, infections of the passages inside your nose. For example, so these are the common causes close to the mouth in the upper respiratory system. Right.
So once we say rhinitis, we might say sinusitis
as well. Very, very important. As well, yeah. Especially chronic sinusitis with the secretions. Those secretions can be what we call purulent or malodorous, and that essentially is what causes bad breath. In the lower respiratory system, basically the lung, the trachea, for example, any infection in that region can also cause bad breath, because essentially your breath is coming from, when you breathe, essentially that smell is emanating from the lung
when
that
comes
off in your breath. Yes. So one of the worst cases of halitosis really I've ever experienced in my medical career was actually a young lady. She was pregnant and she had a pulmonary abscess, and literally it was so fetid. She would open her mouth and the whole emergency room, you would start smelling that. So it really, really was quite
so
something to
pulmonary
smell.
abscess is an abscess in the lung.
In the lung, yes.
Right.
So an infection, a pneumonia, for example, which is an infection of the lung, an abscess, what we call empyema or pus in the lung because of a pneumonia, or foreign object which has been there for a while. And speaking of foreign objects, children, you really can never be too careful with children. They can have foreign objects in their nose. You've found little children, little boys in particular, with little cars of the nostril, and they may not complain, but if that stays there for a while, you can find the body's natural reaction is to react against that. You're not supposed to have foreign objects anywhere in the body, so you find secretions tend to form, and that in and of itself could cause bad breath. Looking at systemic diseases, diabetes again. I'm always talking about diabetes. There is one condition with diabetes called diabetic ketoacidosis, and that could result in very severe bad breath, almost a sweet-smelling odor that we call, because of the presence of ketones. And ketones are products from the breakdown. When the body has no more sugar to break down, essentially you find there's the breakdown of fat, and that results in the formation of what we call those ketone bodies, and that also could result in very, very bad breath. Dr. Daniel spoke a while ago about the fecal odor that we could get generally from the formation of sulfurs, but when you have a condition which is surgical emergency really called obstruction, bowel obstruction, you can literally have the patient, because when you have the bowel obstruction, that means the person isn't passing feces the way they normally supposed to. So that those feces really are in the intestines, and you could have patients vomiting, literally vomiting feces if you have that obstruction there, which can be most of the time because of a tumor, a large tumor, a bowel tumor, and of course that odor as well, you would have that.
So Doc, can I just interrupt a minute so we can go back a bit to diabetes, because I diabetes is a problem for us, and we need people to be able to identify when it is out of control and when it should be treated. We're saying that if the blood sugar is high, that there can be a change in the odor, and you're saying that's because of ketone bodies.
Exactly.
Is there a change in the odor that they might be able to recognize when that happens?
It's a very sweet smelling odor. It's hard to, it's very easy to identify. I can't say everybody would call it the same thing, but when you smell it, it's unmistakable. You cannot miss it. There definitely is something different about that person, the odor coming from that person. And that usually is a medical emergency. Usually that person is very, very unwell. And those are patients who are treated as a general rule in the intensive care setting.
I've heard it referred to as similar to the odor of nail polish because of acetone.
Acetone is one of the,
so the acetone in nail polish has a similar odor.
Can be something
so that acetone breath is something that people should take as serious.
Absolutely.
And it's most likely, in a diabetic who has very high blood sugar, right? And you're now talking about the intestinal obstruction leading to a surgical emergency and giving similar to what Dr. Atef was talking about, the fecal odor.
Yes.
I was saying intestinal obstructions are real surgical emergencies.
They are surgical emergencies.
So that's tool which isn't going
Exactly.
out is remaining and giving
and it
a
has
change.
to go somewhere. It literally
Yeah,
has to
so
go somewhere. So since your what we call your GI system or gastrointestinal system is all connected
Right.
from your mouth, your esophagus, to your stomach, to your small intestine,
Right.
large intestine,
Right.
and your rectum, if it cannot go all the way to the rectum, it will come up.
It will
And
come
that those feces can come up. It can be quite dramatic
Right.
to see somebody vomiting feces, but it does happen in some cases. And that person sometimes, even if they're not vomiting, that fecaloid odor is there.
Right.
And last but certainly not least, I'm a nephrologist, as you mentioned before. So we have to talk about what we call a uremic fetor. And the uremic fetor essentially is a malodorous smell that could emanate from the oral cavity of a patient with late-stage kidney disease. It is not something you find generally in patients with early-stage kidney disease, but stage 4 patients, stage 5 patients, you can have that uremic odor. And literally, it's from the breakdown of ammonia. So
Right.
it can almost smell like urine, the smell of urine on your breath. Now, it's not every patient who has it, but if a patient sits in front of you and you smell it, it's a giveaway. You don't have to see any labs.
Right.
You don't have to see anything else to know, okay, this patient has late-stage kidney disease. It really is a giveaway for
It's a
kidney
giveaway.
disease a lot of the time.
Right.
A patient, you find it a lot in patients, for example, who have stage 5 kidney disease who are not being dialyzed. And when I speak of dialysis, I speak of a process whereby we eliminate some of the toxins in the patient's blood. And by eliminating that, you're reducing the amount of toxin, of course, and you don't have that uremic fetor.
Right.
But if in a dialysis patient, for example, and you go to clinic, you find a dialysis patient has a uremic fetor, what it tells you is that that patient is not being adequately dialyzed. So we have to change that patient's prescription, whether it be get a bigger dialyzer or prolong the time that you dialyzing the patient. A series of things that you take into account
Right.
when the patient has a uremic fetor.
So kidney failure changes the breath as well, gives you
Absolutely.
bad breath,
Absolutely.
and but of a type that smells like
urine, essentially. Yes.
Okay, okay, and it's
Very
basically seen in stage 5.
In stage 4,
It's
late stage 4 and stage
Stage
5
5
patients. Yes.
patients who should most likely be already on dialysis or
Require dialysis very
require
soon.
dialysis very soon. Okay, okay. So I think we're opening up the discussion on bad breath and hopefully getting our viewers to recognize that, listen, bad breath is not always due to poor oral hygiene, that bad breath is actually also possibly a sign of a systemic disease, a sign that there is something internally that's going wrong, or simply a sign that there is a structure close to the oral cavity where there's a problem, like the nose, like the sinuses, like the throat, like the tonsils. Again, signs of diseases. So, you know, when we have conversations like these, we hope that people will become sensitized and understand that, yeah, if you notice somebody with bad breath, hopefully you may be able to alert it to them in a way which makes them aware of it, so that in a tactful way, in a way which doesn't make them feel bad. Or people should realize that they should not feel bad if that is brought to their attention, that it's not really anybody trying to put them down. That is something that they should note, because it can be dealt with. It might be something that they're overlooking, but it can actually be a sign of something that's going really wrong,
yes.
of a medical condition that needs to be taken care of. Definitely.
Most definitely.
Okay, so in summary, we're going to close our discussion on bad breath. Dr. Atef Daniel, in summary, take-home messages before we go to our second segment where we deal with the Cuba Appreciation. We take-home messages here dealing with bad breath originating from the oral cavity.
All right, well, let's talk bad breath in general, because when somebody has that malodorous smell, sometimes it's hard to decide where it comes from. But the first thing that should be done is to deal with the oral cavity. Go to see the dentist, get an exam done.
Right.
See what's happening with the teeth, whether there's any tooth decay,
Right.
whether there's any infectious process in the mouth, eliminate gum disease. And after that, if it doesn't disappear, we can start looking for systemic causes. But it's very important. Take-home messages. I always tell my patients, when I speak to them, that there are 2 proverbs that I use. Look, it is that prevention is always better than cure.
Definitely.
The stitching time always saves 9.
Definitely.
And however you choose to look at it. So you have to go in. You have to get those exams done. yes, we've given information tonight that is going to help, equip persons to, think a little more deeply about what is going on with them. But they need, because you can't do it on your own. Even if you decide that you're going to take very good care of your teeth, brush, floss, as we ask, doesn't mean that it's not going to happen. But you need to go in regularly to get those exams done, to know that you have a clean bill as far as the oral cavity is concerned. So you need to visit the dentist regularly, in addition to all those oral health practices that we advise. Take it seriously, and it can help to prevent. And we have not spoken about the discomfort and the pain that can result from these oral diseases tonight. But it can be very severe, and you can go for a very tough time, and all of that can be avoided.
Oh yeah.
By just trying to prevent and trying to get it detected very early and treated very early.
Definitely. Okay, so Dr. Clarke, you've really gone far with kidney disease, putting kidney disease out there, getting people aware. I think because I have you here, I want to ask you just a few questions about the kidney. Hopefully that our viewers will get into it as well. The kidneys are important, and in summary, important why?
The kidneys are extremely important. I think we tend to take them for granted, but they have so many important functions that when they fail, so many things go wrong. They really affect every organ system. In particular, there's a syndrome called cardiorenal syndrome, and cardiovascular disease is still one of the leading causes of death in the world. And a patient with kidney disease has a huge independent risk factor for cardiovascular disease. So if only for that reason, you have to take care of your kidneys. In terms of the role of the kidneys, they can help control blood pressure. They control bone health, responsible for bone health in large part, your blood count. They produce urine, and with the production of urine, you get rid of several toxins. So it's a series of things that the kidneys do that, if they aren't functioning properly, these things aren't happening, and patients can present with a wide array of symptoms, and they really, really do feel unwell, and treating kidney disease is extremely expensive. Hence the importance of trying to prevent patients from developing kidney disease.
I mean, we have a number of people who need dialysis.
We do have a large number of people
who can't get dialysis. So we need everybody else who's well to take care of their kidneys, so we don't have
who assumes that they will.
Yeah, well, we need to get tested and know their status where the kidneys are concerned.
Absolutely.
Definitely. So I think we've concluded in summary. Oh, I need you, Doc, before we take the break. So please tell us about your Celebrity Sports Day, which is to raise kidney awareness.
I'm very excited about. So as part of our plans for Kidney Week, and Kidney Week would be next week, World Kidney Day is on Thursday the 12th. We're having a Celebrity Sports Day on Sunday, March 15th. And when I say celebrities, I mean all our local celebrities, Dr. Matthew here, for example, all our politicians, our media personalities, members of the Bar Association, the Medical and Dental Association, just participating in fun sports, cricket, football, basketball, netball, hula hoop, and also our soccer artists are going to be performing. It's just really an activity to get everybody out, because when you have celebrities, you tend to get the general public out, because who really doesn't want to watch the politicians hula hooping and that kind of thing. So the idea really is to get the general public out, so we're able to do our educating.
Wonderful. So where is it? And
it will be held at the Bossage Indoor Facility from 10 a.m.
10 a.m. on?
From 10 a.m. onwards.
On what date?
On Sunday, March 15th.
Sunday, March 15th. So our viewers, hopefully most of our viewers will be at Bossage.
It's a place to be.
Viewers, we'll be right back. We'll take some of your calls and we'll get into Cuba Appreciation Week. Our experiences we will share with you, and we will give our gratitude to the Cubans for our training. Stay with us. We'll be right back. Welcome back, viewers. I hope you've been enjoying the program as much as we have. We've been talking about halitosis. Well, we spent the first half of our program talking about halitosis, also referred to as malodorous breath, or colloquially bad breath. I've had the pleasure of having with me Dr. Merle Clarke, a nephrologist, and Dr. Atef Daniel, who's a dentist. We're going to take your calls, but now we get into the second segment of this program, where we want to deal mainly with the Cuba Appreciation Week, and it's all about us graduates of the Cuban medical and dental system, well, tonight at least, sharing our experiences and giving our gratitude. So we figured that we're going to start talking from, the onset of we having, each one of us having gotten a scholarship. I think Dr. Atef Daniel will start telling us about what that meant for him when he first was told that he got a scholarship to study dentistry.
Well, you see, I wasn't told that I had got a scholarship to study dentistry. I heard about the scholarships, and when I actually run to the ministry.
Dr. Daniel, we have a call. We're going to just take this call. Good evening, caller. You are on the air.
Hello, good evening, Doc.
Good evening.
There's something that happens to me, and I asked other human beings. They said it's happened to them also. Sometimes when you cough, there's this yellow thing that's like cheesy. It's a small spongy thing that comes from, I think, the tongue or the throat, wherever it comes from. And when you squeeze it, it has an unusual smell or the odor. What is this like?
It's something, caller.
Yeah?
You're saying it's something that comes up after you've coughed.
Yeah, it's like a small piece of like cheesy thing, it's yellow, and when you squeeze it, it has an unpleasant odor.
Right.
And I asked somebody about it, and they told me like it's like when you eat hot food, it stays at the back of the tongue, and after then it comes up. I'm just asking, is that true, or what does that come from, between the teeth or the throat, wherever?
Right. Well, from your description, it sounds like it's coming from somewhere in the respiratory tract. It would sound to me like it's dried mucus, which if it's dried mucus that contains any amount of pus or secretions, then it would definitely have a bad odor when it comes up. Definitely, caller? Yeah, it would definitely be that.
For that? Do you have to visit a dentist or general practitioner?
Well, I think if it's coming from the respiratory tract, it's something that comes up after you cough, then you would want to check with a general practitioner first.
Okay. And the other thing, for years and years, I've been trying to brush my tongue.
Right.
But I cannot do that. Every time, every morning, every night when I try to do it, it's difficult. Where can I get the thing you spoke about, the gadget? Like that?
Right, the tongue scraper.
Where can I get that? Yeah.
Well, I think Dr. Daniel, you want to comment on that because you spoke about using a spoon, a plastic spoon.
Yeah, you can check the pharmacies. I have seen in some pharmacies. I mean, it's not available all the time, but I mean, you can always order it, really. I mean,
Right.
these days you can order anything, really. There are a number of tongue scrapers out there, different types. You can take a look at it and order it, really. But if you don't have a tongue scraper, I mean, a simple spoon would do, or the toothbrush would do as well. But what I find interesting is that the caller said that he hasn't been able to actually brush his tongue. I'm wondering why. Whether it's because of the gag reflex.
I think it might be the gag reflex.
Yeah.
But I mean, I think if we remind them that
Right.
if you use something to the back of the tongue and pull downwards, you would get it out.
You would get it out, and not only
Definitely.
that, saying while
Right,
you're doing
while you
it,
do it
that
would
actually
block
helps
the gag reflex.
to block the gag reflex, really.
Good evening, caller. Thank you for holding. You're on the air.
Yes, good night.
Good night.
And I appreciate your program very much, and I want to thank you for having that program.
Thank you very much.
The caller said a while ago that there is this thing that when he coughs, but I have experienced that before myself. In fact, sometimes even recently, I had that, and it sticks in the corner of the throat, like there is a little hole. It makes a little hole in the side of the throat, and sometimes I have to get something to take it out. I went to the doctor, a specialist, once in Viewfort at St. Jude's, and he told me that this is a cause of, what's the name? Oh boy. How you call this thing, when you have this thing in your nose or whatever? Sinus.
Okay.
It's a sinus effect.
Right.
That's what causes that. But I never went back to that specialist to find out, to follow up on that thing.
Right.
But it used to happen a lot in my throat.
Right, right. Caller, well, I think obviously we would suggest that you go back to that specialist. But you know, a consideration may be the tonsils. You know, towards the back of the oral cavity is the tonsils, and they have deep indentations that we call crypts, where debris, food might actually get lodged, and you know, and could be the cause of malodorous breath. You know, could be what you find actually coming out of that area at some point, getting dislodged.
Right.
Okay.
Because when you cough, there is an increase in abdominal pressure. So
Right, so it pushes it out. Right.
Could be
So
that.
what can be done is to, you know, when it's a mouthwash, or even warm salt water we do as well, to try to gargle it all the way in the back there, really,
Right.
so that it gets to the tonsil area and it helps to clear that area.
Right, right. Okay, thank you for calling. Okay. Good evening, caller. You're on the air.
Good night.
Good night.
Can you help me please to tell what for bad breath? What you have to use
Sorry?
for bad breath? Yeah.
I didn't quite hear your question, caller.
I-
I didn't quite hear your question, sorry.
Are you asking what you use for bad breath? Is that what you're asking?
Yes, please.
Well, again, it would depend on the cause of the bad breath.
That's right.
As Dr. Daniel said, if it's coming from inside the mouth, then you'd see your dentist. We need to figure out what exactly is going on there. If it's not coming from inside the mouth, then the underlying cause would have to be treated to get rid of the bad breath, basically.
Okay. And which doctor have to see?
I think we've come to a consensus that you would start off by seeing a dentist, because you know in most cases of bad breath would be originating from the mouth, the oral cavity itself. That after seeing your dentist, if he doesn't think that it's coming from the mouth, then you should see a physician, a doctor, general practitioner, most likely, so that they can see whether or not it's the sinus, the nose, the lungs,
And if they need to refer
you know,
to somebody else.
and then you might get referred to a specialist depending on what they found. So probably you should start with your dentist, ma'am.
Okay, thank you.
You're welcome. Good night. Great. So, Dr. Daniel, we were about to talk about our Cuba experience and where it started for you.
Yeah, I was saying that, you know, I actually heard about the scholarships from my mom. Somebody told her, and I ran down to the ministry. And of course, that batch of students for that year.
Sorry, we have another call, so we're going to just take this. Good night, caller. You are on the air.
Hi, good night. Yeah, about that little thing this caller was talking about a while ago, coming. I does experience that same thing also, and I don't think it has anything to coughing or anything, because I open my mouth, I look inside all the time, and I have to use the long thing and I press it out.
Right.
Sometimes when I press on my or on the outside, I could see it coming off, and you know,
Right.
it has a bad odor. My breath don't stink, but apart from that, when you have a nice scent at all.
Right, right. Really does sound like the tonsils, but I think I'd advise everybody to get that seen, you know, get seen by a dentist to start with, so that you can get some more concrete advice. Mm-hmm.
Yeah, because the male dentist there, he was saying about brushing and goggling. I do all of that. I look inside when I brush in, I even have a scraper. I do all of that.
Right.
You know, I take my time, but it's just that thing there. I don't know if I clean my hair too. I don't know. It's just, but that thing is always there every like a week. I would find it there, but I always look for it.
But do you suffer from sinus problems?
And the place where it's coming out, it's kind of cutting up. It's not like there's just a hole. You could see like part of the foot on the inside is cut up.
Okay.
I don't know what infection it might be. There's no pain, but that thing is just coming out every so often.
Right. Yeah, so caller, I really do think it is best if you start by getting it assessed by a professional. Start with a dentist, and definitely they will take it from there.
Okay then.
Okay? Okay, thank you for calling. We have another call. Okay, we think we just lost that call. So, as we were saying,
as we were saying, so I went down there. A batch of students for the year had already left, and I decided.
Okay. Tell you what, we're going to try to concentrate on taking the calls in this segment, and then we'll. Good night, caller. You are on the air.
Hi, good night.
Good night.
Good night.
I would like to congratulate all of you for doing such a wonderful job.
Thank you very much.
Dr. Daniel, I'm quite impressed.
Thank you very much.
I was actually calling with reference to the first caller, and right away it reminds me of patients that I've seen who have impeccable oral hygiene.
Right.
But usually what I ask them is their eating habits, because you find a lot of persons, they eat hot foods and then they drink something very cold.
Right.
Now when you chew and you eat something very hot, the fats and everything, they melt and then it slides down to your throat area. And if you drink something very cold right away, what happens? It clumps up. And what happens, it clumps up in the tonsils, as you were saying, Dr. Matthew. It clumps up in the tonsils, and it stays there, and it can stay there for weeks on end.
Right.
And if this action is repetitive, you find that there'll be a lot of buildup in the tonsils. For some persons, they actually get an infection, they get tonsillitis. For other persons, they don't get any pain or any infection. But what happens after a while, you find that those little plaque deposits in the tonsils, they get dislodged. Now, some persons, they would scratch, for a better term, the back of their throat, and you will see the little white particles coming out after they scratch their throat, making this funny sound.
Right.
And it really, really does have a bad odor. So for the caller before who was saying that he has very good hygiene, it could be the manner in which he actually has his meals, whether he, has something very cold after his meal.
Right.
And it could be plaque deposits. But as you said, he has to be assessed by a dentist.
By a professional, definitely.
Yes.
Thank you very much for calling.
You're most
Sound like a colleague.
Thank you.
Good night, caller. You're on the air.
Yeah, I called earlier on and she was just talking about me. I truly believe what she said, because after I drink a hot tea or eat a hot meal, I like very close to thing behind it. So kind of makes sense. I'll stop.
Yeah, you should drink some hot tea after your meal, huh?
Or some warm tea.
Sorry. I mean, after I drink the hot, I go for a nice cool glass of water.
Okay, so that's a consideration.
And it's something I do all the time, so I'll try to stop that.
All right.
Nice.
Okay, thank you for sharing that. Okay, good night. Hello, caller, you are on the air.
Hi, good night.
Good night.
Good night.
Where does Dr. Clarke have her office?
Dr. Clarke, you want to share with us?
Well, I work at Victoria Hospital, also St. Jude Hospital, and at Tapian Hospital, but just on weekends.
Okay. So, callers, I would like you to stay with us. I'm going to make this our last call because we really want to show some appreciation. I know we have a few calls, someone to cover. Good night, caller, you are on the air.
Good night to all of you.
Good night.
I couldn't help, but I need to ask a question about, I don't know, the person who called you. I suspect it might have been a doctor to answer the question about the hot and the cold food.
Right.
Can you give, for my sake, and maybe some other person's sakes, this thing about eating hot, very hot food and very cold food. I mean, tell us what's good or bad about it, whether you take it one after the other. And I particularly want to know what is good or bad about chewing on ice, because I seem always to be craving for ice. And
Chewing
if I
on
have
ice.
to drink water, I must fill the glass just so that I could get the ice to chew on. How does this affect my health? Because my sons get very angry with me They say, you know, I know ice makes you fat, and some other persons say it might affect the teeth. So I'm going to get offline so that you could send me about the chewing of the ice.
The chewing of the ice. Mom, I find it very interesting that your sons would get angry at you for chewing on the ice, not the other way around. Okay. Thank you for sharing
I
that.
have together because I can hear you better when because I cannot hear you when I'm on the phone.
Okay. Thank you for sharing. We'll answer you off air.
I think I could try to respond to why she's chewing on ice, because a lot of the time, chewing on ice a lot or eating odd things. I know people with soap, for example, or dirt. A lot of the time, that's a sign of something we call anemia or low blood count. So more than what the effect of that is, which could be a mechanical, for example, if you're chewing on ice or anything hard, Dr. Daniel could tell you that you could potentially break your teeth.
That's right.
You have to see, why are you doing it? How long have you been doing it? And I'd say you need to get, for example, your blood test done, see what your blood count is, because it may be a sign of a low blood count.
And Dr. Daniel, eating cold, eating very hot, going from one temperature to the next, what do you think?
You know, I've actually posted a question to my daughter's medical doctor.
Okay.
You know, in Saint Lucia, you say, you know, when you just wake up in the morning, you're supposed to drink something hot and not cold milk. But then now you know, get the habit of drinking cold, really. And is there really an effect?
Right. Well, I think I would like to share that there are studies suggesting that very hot tea, I don't know about very hot food, but very hot tea can be a cause of cancer of the oral cavity. Yeah.
Mm-hmm.
So hot tea, definitely very hot. It's steaming tea, to be precise. It's considered a risk factor for cancers of the oral cavity. So that you definitely don't want to do.
I've seen in a lot of Asian countries where they drink very, very hot liquids. But to go back to the question, whether there's an effect, a negative effect of the hot and the cold, I think growing up we all heard that. In fact, it went as far as you could get a stroke if you came from the heat and you went and opened the fridge. No, that's not the cause of a stroke, definitely not. But with the hot and cold, I think the body has its mechanisms to deal with that. So for the most part, I don't think necessarily just because I drink something hot now and a bit later on I drink something cold, that's going to negatively impact my health.
Right, definitely. Good night, caller. You're our last call.
Good night.
Good night.
One question.
Yes.
Oil pool. I just want them to explain where the oil pool really works.
I'm not sure that we're hearing you clearly. Oil pool?
Oil pool.
I don't know what that is.
We're not understanding what that is.
Oil pool is a process by where you use oil, coconut oil or olive oil, and shake it in your mouth.
Oh, okay.
For about 15 to 20 minutes, and then spit it out.
Okay.
Do you think it really helps with bad breath?
Okay.
Oh, really?
Okay.
That's the first one for me, right?
Definitely. This is caller. Thank you for sharing this one. This is new, I think, for everybody. Yes, like gargling oil.
Gargling oil. That's one that has to be investigated, really. I haven't heard of that one there, really.
Yes, definitely. But we know oil, coconut oil, has been touted as having lots of medicinal properties of late especially. So maybe that's something that we need to look into.
Definitely.
An all Indian remedy for bad breath.
All Indian remedy. Okay.
All Indian, and I'm supposed to know that. Well, you see, the thing is,
we can't say yay or nay. We really don't know. I don't know.
No.
But certainly that's very interesting.
It is.
Yes, it is interesting. Thanks for sharing that, caller. Okay, so we'll take a break. When we get back, we will be dealing with Cuba Appreciation Week, and finally we'll get a chance to share our experiences and give our gratitude to the Cubans for our education. Stay with us. You're watching Pulse live on Choice TV. Welcome back. So we're now at our final segment, and we're finally getting a chance to talk about our Cuba Appreciation Week. And Dr. Atef Daniel had started telling us about him, looking into his scholarship and actually getting a scholarship to study in Cuba.
Right. So, I'm a Jackmel boy. I like to say a Jackmel youth sometimes, maybe.
Right, a Jackmel
so
youth.
you know what Jackmel is. I mean, that's in the heart of Roseau. That's a farming community. That's
Farming
where I grew up. My parents
yeah.
were farmers. Basically, that's all I did. I mean, I went through school, went to A level. Eventually, I got a job, but still did the farming thing. Used to go to the wharf to sell bananas at all odd hours, and then get up to go to work. That sort of thing. Get up to go to school. So you always want to further your education, but then you always wonder, but how is it going to happen?
Right.
And then the Cuban scholarship. When I heard about it, like I said, I went down to the ministry, and the following year I applied.
Right.
And actually, I wanted to do medicine. But I figured that it would be a little easier to get a dentistry scholarship.
Right.
Turns out
actually more difficult.
Turns out about 30 medicine scholarships were given and only one dentistry scholarship was given.
Right.
But up to this day, I've not regretted it, really. But that just shows where I came from, and the possibility of actually ending up in this career would probably have been impossible if it had not been for the Cuban government and the Cuban people, the generosity of the Cuban people. So am I grateful? Eternally grateful.
Dr. Daniel, you ever took a look at how much it costs to study dentistry? You have any estimate?
I did, but I can't remember right now. I just know that I would not have been able to afford it.
Right.
Not by a long shot.
Right. Well, I think dentistry is more expensive than medicine.
Yes,
and that I'm aware, medicine will cost anywhere from $300,000 to $500,000 EC dollars.
The question is unquestionably prohibitive for the large majority of people, I think, who studied in Cuba. Without the Cuban scholarship, I do think most of us would probably have stayed, and there's nothing wrong with teaching, but that probably is what most of us did before we went off to Cuba, and that's what we would have done, because really, those amounts that you're talking about, which is what it cost, because I did look, for example, into several options, St. George's and a few other options, and the costs really were prohibitive. It's like, that's not for me. So, I mean, we are, like Dr. Daniel said, eternally grateful to the Cubans, the generosity of the Cuban government and the Cuban people, that today we are doctors. Right. In my case, I did medicine, finished in 2007, then went back to specialize in Cuba again on a scholarship. So in my case, twice I did also very grateful for that.
Yeah, so you did your degree of the doctor of medicine, and then you actually became a nephrologist because of the Cuban system and their generosity. I go back to seeing myself. I was a teacher then, actually. I was a teacher at Leon Hess Comprehensive Secondary School. I taught maths and chemistry. And I go back to remembering seeing myself seated there, telling my students how I was looking forward, not just to studying medicine, but to experiencing a country in which there was a doctor for every 100 people, and a country in which healthcare was free for everyone, So, I would like to start by saying that studying in Cuba for me was not just about getting the opportunity to become a doctor. For me, it ended up being the opportunity to experience what healthcare really should be. And I'll share with our viewers that I can't be sure that I believed in medicines and in healthcare being able to achieve much before I went to Cuba. I have one experience that always comes back to mind. Right? I used to think about diabetics before I went to study medicine, and I always used to think that diabetics were just badly off. That in the not too distant future they would be blind and they'll be amputated and they'll have kidney failure and all that. And I vividly remember this gentleman. I was standing by the road, and I met this gentleman. He was in his 80s. This gentleman looking so good in his 80s, and I asked him, speaking, he told me he's diabetic and stuff. And I asked him, but how can you be diabetic and you look so well? And he told me he's actually diabetic from the time he was in his 20s. Talking about a gentleman standing on the side of the road, looking as in impeccable health as you can imagine. And he said simply, I have just always taken my doctor's medication. Listen, that blew me away. I couldn't believe that was all. So I asked him, you serious, that's all you did? He said, yes, I just always took the doctor's medication and followed the advice, took care of myself. And this is a gentleman who went at least 60 years of being a diabetic. So Cuba was the first place for me that I started to see that kind of effectiveness of healthcare. That you see people who are elderly going into surgeries and coming out healthy, that you experience a system where, and I must say this is another one for me that's always so big, that I remember when we did community medicine, and we worked alongside the community doctors, you know, the family, what would be similar to family medicine doctors here, and they were under pressure. They were under pressure because in Cuba, so they were under pressure, especially for the pregnant women,
Yes.
right? Because in Cuba, if a lady dies in pregnancy, or a child dies in the first year, what we refer to, first year of birth, what we refer to as infant mortality.
Right.
You know, in Cuba, they have to go to Havana to explain to the ministry and the Minister of Health how that child
What
died.
happened, yeah.
You know, and they investigated to the T, and it's so much pressure. So what you end up finding is that there's just this great
And the infant
effort.
mortality rate is one of the lowest in the world.
In the world, the infant mortality rate is one of the lowest. So it's again, it's a system where you get to experience responsibility and accountability in healthcare, to the point where it's a legal issue. You can be fined, you can be jailed, and you just must make sure that you're really doing well.
A more humane kind of medicine, I think, because medicine as a career, you have to be humane, I think, to do medicine. But there's just this sense of more humanity, I think, with the Cubans. The sense of voluntarism, I think we have, sometimes we lose that a little bit.
Definitely.
That is very, very strong, a big thing for them. And I do think it's something we as Cuban grads in particular do need to continue, that sometimes we lose that. Again, our excuse is that we're busy, but we do need to learn to give back, I think, be appreciative
be more
give back.
Definitely.
And something we cannot forget as Cuban grads is Spanish. We all speak Spanish fluently, and I think nothing can make up for that. We do speak. So
thank you for reminding me,
though. I speak Spanish, Creole, and
yes,
English fluently.
I'm really happy you're reminding me, because we're going to end this program talking Spanish, everybody here. So viewers, you can look forward to us talking Spanish at the end, at least talking to our Cuban brothers and sisters, and saying thanks in Spanish in a little bit. Any other?
Yeah, but I think that one thing that stood out for me was the fact, you know, when we went to Cuba, and I mean, we went in the same year. We did our what we call a prep year, the year of Spanish together.
Right.
And you know what it was like. I mean, it improved a little bit after that, but we went towards the end of what was called in Cuba, what was known as the Periodo Especial, that special period after the fall of Russia.
Right.
When, you know, we fought an embargo,
lots of
and Russia was the country supporting Cuba, and man, it was terrible in Cuba. It's one thing to invite somebody home and to give them, when you have your cup is overflowing, and to give them and to be generous to them. But when you don't have, you can hardly make it, to extend that hand of generosity.
Yes.
I'll never forget that. I mean, the first, you know, this initial question that they give you at the beginning of a class, and they give you a little slip of paper. The paper was so small I couldn't even write the answers on it.
Yes.
You understand?
Yes, you're very right.
But they did provide paper and pencils.
Right.
Definitely.
I studied in Cuba. I used to roll up, I mean, I was in my last year, the last year of my career. I mean, that's the way I am, really. I used to roll up my exercise book. You know, down here, they make a fuss about writing in pens.
Right.
From the time you reach, I can't remember now, whatever grade, you can't write with pencil anymore.
Yeah.
But we used to do our exams in pencil. I used to roll up my exercise book, not a notebook. You know, you have all these fancy notebooks.
Right.
I used to roll up my exercise book, push it in my back pocket, and I have a pencil in my pocket, and I go to the hospital to my class. You understand? It's that sort of thing. They didn't have a lot, but whatever they had, they gave and they provided.
Absolutely.
Oh yeah, and I would go even further and say that they had very little, but they gave you the best they could.
They did.
That's
And
right.
they treated us as foreigners, as if, you know, they needed to make sure that, you know, we were well taken care of, despite them being poor and despite them having all their challenges,
and the
you know.
embargo and everything, and the ability to improvise. It's amazing what a Cuban can do.
Oh yeah.
I mean, who throws away shoes in Cuba? Remember, ever throw away a pair of shoes? Nobody throws away.
And everything gets fixed in Cuba. If you have a
Absolutely.
watch or whatever, it gets fixed. You
Look
know,
at those old cars that have been kept running for
from the 50s and
60 years. And they're still running.
It's amazing.
Yes, my broken glasses would fix in Cuba in no time.
Absolutely, they're ingenious in that way.
Yeah, definitely.
Oh yeah, but you know, if I should mention one other aspect that I was always very impressed with, is the attitude in healthcare. You know, I mean, the Cubans have tremendous difficulties. And before you get to the hospital, the Cubans complain a lot. They complain about the system, they complain about the bread, they complain about the medications and the things that are not coming in, you know, and their tiny salaries. But you see them go into the hospital, And they treat their patients and they treat each other while they're at work.
Absolutely.
As if everything is fine. Some things I try to remember and I rack my brain. And I'm saying, but I can't remember a nurse being angry at the hospital. I can't remember a doctor being angry at the hospital. I just can't remember that. Do you all remember that?
No.
No. And you think about them and you say, but with the difficulties that they were having, you'd expect that, it might have shown in their professional practice, but they just did not allow it. And it's something that I think, we should always keep in mind that we shouldn't let our own struggles and difficulties affect the way we attend to the people who are sick, the people we care for,
Absolutely.
I think I should speak on behalf as well of all those people who got scholarships to Cuba. You see 3 people seated here and you think, okay, it's just 3 of them. There were many Saint Lucians who studied in Cuba. I'm sure we might get close to 500 by now. But it's not just Saint Lucians. We're talking about people from all around the Caribbean. We're talking about people.
I think right now, any island you go to, there'd be somewhere you could stay. Nobody needs to stay in a hotel.
Oh yeah, you're talking about people who were from Latin America.
Absolutely.
Loads of them. People from Africa. Thousands and
even
thousands.
The US,
even the US had people in Cuba on scholarship. Yes. So there are thousands and thousands of people who would have benefited from it. And our countries are benefiting from the training that we got. Because now Dr. Clarke is a nephrologist, taking care of kidney kidney disease, and Dr. Daniel is at the polyclinic. And I'm in different levels, and we have people who work at the ministry, we have people all throughout the island.
Heads of departments.
In
every area of health.
Oh yeah, in every area of health. We have multiple specialties which are because of Cuban training, definitely. So,
and what I really appreciated and really caught my attention as far as medicine in Cuba is the amount of time that was spent with patient.
Right.
In just doing an interrogation, just talking to the patient.
Right.
And that is something that we are taught. That is key, really. And I'm not going to hate anybody tonight, but that is something as medical professionals, we treat our patients, but it's not a matter of getting them in, getting them out, handing them a prescription, and they go home and they have no idea.
Right.
Patients come to my office and I ask them, are you on any medication? They tell me a red tablet.
Yes, that happens.
The time for that is gone, really. I mean, in Cuba, like you rightly said, every patient knows, no matter what age, knows what medication, what their conditions are, what medications they are on.
Right.
When you start, at the hospital, the guys will come home and say, but it's easy studying medicine here. The patients would come in and tell you what medication they take.
They would tell you what antibiotics to give them.
what dosage they would take.
And that's right.
You understand? And it becomes fairly easy. And that is what we should aim at.
Right.
You understand? Not a practice of medicine where persons regard us as gods, as used to happen back in the days.
Yeah.
No. We just know a little bit more about medicine.
You shouldn't be intimidated by your doctor. You should be able to have a conversation with them. And sometimes that does not obtain here at all. The patient just believes if you tell me that's the way it goes, and I'm not going to ask you any questions. I will say we're human, and sometimes we forget. The onus is on you to ask if you're unsure of something. Because you see patients sometimes when you sit there and you talk. I, for example, like to talk. So I talk a lot. And they'll come back the next clinic appointment and say, what did I tell you? And they have no idea what you told them. So the question is, if you did not understand, why didn't you just ask me? Right. And I guess they're just intimidated by the fact that, okay, the doctor is talking. And that's not the Cuban patient at all. No. The Cuban patient is going to have a conversation with you. And if you don't know your medicine, then they know it better than you. So you better be on the ball.
You better be on the ball. Definitely.
Yeah, so that is what we should be working towards as medical professionals, that we sit with our patients, because at the end of the day, after we've treated them, they're the ones who go home with their conditions.
Yes.
So they need to understand what the conditions are and what they need to do to take care of themselves. It should be.
Well, I'm happy you're mentioning this because I think it's everything in healthcare. It's empowering our patients so that they can take care of themselves. Because they're the ones taking care of themselves on a daily basis. If they don't understand what's going on with them, they can't do it. And then they keep coming back to us, and overburdening actually the healthcare system. So it's all about communication. It's telling them, explaining the results, explaining the findings, explaining, and being patient in words they can understand, and being patient in doing that.
That's right.
So doctors, colleagues, I'm going to ask that we switch over to Spanish. Viewers, we're going to ask that you stay with us and take in a bit of Spanish as we speak to our Cuban brothers and sisters. and share appreciation with them. Dr. Atef Daniel, voy a preguntar, a pedir que tú seas la primera persona de hablar en español, hablando a nuestros hermanos y hermanas cubanos.
It's been 10 years, huh? Might be a little rusty.
Dale,
Pero,
en español.
pero puedo decir que, bueno, de mi corazón, yo doy la gracia primero a Dios y al pueblo cubano y a Fidel, porque fue idea de él abrir su país a todos esos extranjeros, a darle una oportunidad para estudiar, para hacer una contribución a su país. Y queremos dar esas gracias. Lo que yo hice en Cuba, yo estudié una carrera de estomatología, pero a pesar de eso, o además de eso, yo hice muchas otras cosas. También la música, tocando música y toda esa cosa. Y el pueblo abrió las manos para recibirnos. Cualquier cosa que hacíamos allá, siempre estábamos atrás apoyándonos. Y eso es una verdad, eso es una cosa buena que siempre va a estar en mi mente. Y los cubanos que están aquí, quiero decir que ellos pueden contar con nosotros. Cualquier cosa, pueden buscarnos para ayudarle en cualquier manera que podamos.
Bien dicho. Doctora Clarke.
Bueno, también decir que estoy muy agradecida por la oportunidad que tuve de estudiar, no solo medicina, pero también la nefrología en Cuba. Y lo mismo yo pienso, mis amigos, todos los compañeros que también estudiaron en Cuba, antes y después, es una oportunidad que no hubiéramos tenido, de eso estoy segura. En el caso mío, por ejemplo, nunca hubiera podido pagar para hacer medicina, entonces por eso soy muy agradecida que ahora tengo la oportunidad de ayudar a mi pueblo. Soy la única nefróloga aquí, y antes de mi llegada, los nefrólogos aquí también eran cubanos prestando su servicio para ayudar al pueblo de Santa Lucía. Y no solo en medicina, pero en deporte, en varias otras cosas, que los cubanos, la verdad que tienen los corazones más grandes en el mundo, y soy muy agradecida por la oportunidad que tuve.
Bien dicho. Por mi parte, voy a decir gracias a los cubanos, como dijo el doctor Daniel, de corazón. Si nosotros de cualquier manera podemos devolver a Cuba lo que Cuba nos dio a nosotros, seremos muy dispuestos a hacerlo, porque lo que Cuba ha dado a nosotros como personas y a nuestros países, realmente ningún otro país en el mundo pudiera dar. Entonces decimos gracias de corazón. Los cubanos son nuestros hermanos ahora y para siempre.
Para siempre.
Viva Cuba.
Que viva Cuba.
Cuba.
Viva Cuba.
Viva Cuba.
Viewers, you've been watching Pulse live on Choice TV. I think this program might be rebroadcast, so you might have a chance to brush up on your Spanish. So you might, for the next program, follow what was said at the end. It was said in Spanish, as I said, to allow the Cubans to, to really understand that we appreciate them, and we're grateful for what we were given.
Essentially.
Thank you for staying with the program. Thank you for your calls. Again, it was a pleasure. Thank you very much once more to Dr. Atef Daniel and to Dr. Merle Clarke for being here on Pulse. Thank you, viewers. Good night. Look out for our program next week, Tuesday.
Buenas noches.